Hello, I'm Dr. Todd Husty with Medical Audit Resource Services, Inc., or Marcy as we call her. I'm here to talk about HHS HCCs, also known as commercial HCCs. It really is the newest wave in medicine. Medicare Advantage HCCs has been in place for almost 9 years now. The Health and Human Services HHS HCCs is just going to start January 1st, 2014. Let's look and compare these two risk-adjusted reimbursement programs. Here's how the HHS HCC exchanges are going to work. Each patient enrolled in a state insurance exchange plan will have their health care status risk adjusted using a model very similar to Medicare Advantage. Both HCC models utilize diagnostic codes from ICD-9, which will be ICD-10 starting October 1st, 2014, to categorize the overall health care and financial risk for each individual patient. If you combine them together, there's a calculation for the average risk score for a plan's enrollees. A risk pool, or collection of revenue, will be funded for each state based on the enrollees of all the plans. Using an estimated average risk score and the number of enrollees, each plan will receive their portion of the risk pool to pay for all of the covered healthcare costs. Now here's the tricky part. In June 2015, a payment transfer formula will be applied to each of the plans within a state. Effectively, what it means is the plans with a lower average risk scores for 2014 that may have been, quote, overpaid will be reimbursing the plans with the higher average risk scores during 2014. So, unlike Medicare Advantage HCC, in which each additional risk diagnosis increases the pool in HHS HCC actually remains constant, but the risk adjustment will occur, but it's between the plans. So let's bring it home. How will this affect you? Obviously, and very importantly, the revenue of a plan is based on identification, documentation, and coding of all risk-adjusted conditions. The hierarchical part is simply that the most severe manifestations of a disease is given more weight than lesser manifestations. It also includes the concept that vague diagnoses such as symptoms carry less weight than more specific diagnoses. And it also includes the concepts that some disease interactions also increase risks, such as COPD and CHF together. HHS HCCs is set up exactly like MA HCCs in reference to categories and hierarchies, but they include all decades of life. The diagnosis codes are very similar to Medicare Advantage HCC, except for the addition of things we didn't see in Medicare Advantage, like pregnancy and newborn conditions, and the glaring addition of asthma because it more severely affects patients in the first 3 decades of life. This means that providers that are already experienced with Medicare Advantage will find the new model pretty easy to understand. Unfortunately, there is a downside. Any person or entity that helps create an overpayment or, quote, false claim can be liable for repayment. That includes physicians. This again highlights the need for thorough and specific documentation, followed by really good code.